America's food safety laws have slowly matured over the last 400 years. Although we have come a long way, our system still reflects a past history of complex laws and regulations. Let's begin by going back in time to see how our federal food safety system has evolved. One of the first food safety laws in the United States dates back to the 1640s, when the Massachusetts Bay Colony enacted the Bread Law of 1646. The law regulated the quality and price of bread. It also required that each loaf was marked so it could be easily traced back to its source. Massachusetts also passed the first comprehensive food adulteration law in 1785, entitled An Act Against Selling Unwholesome Provisions, where violators could be sent to the pillory for selling a food or drink that was diseased, corrupted, contagious, or unwholesome. The primary function of federal agencies is to regulate food products that cross state or international borders. The first home for food safety in the U.S. government was the U.S. Department of Agriculture, or USDA. The agency was signed into law by President Lincoln in 1862. In addition to federal agencies, each state has its own regulatory oversight within its jurisdiction. During the late 1800s, the growth of railroads and other transportation networks resulted in a food production shift from backyards to farms that were able to supply food from hundreds of miles away. As a result, food safety became an increasing concern. In 1906, Upton St. Clair caused a public outcry with the release of his largely fictionalized novel titled The Jungle. The book told an unfortunate story of a Lithuanian immigrant who worked in Chicago's meatpacking industry. The story exposed the horrific working conditions and unsanitary practices within slaughterhouses and processing facilities, and became a major driver for food safety reform. In response, the government passed the Pure Food and Drugs Act and the Federal Meat Inspection Act. These acts focused on food safety for American consumers rather than inspections for foreign trade. The Pure Food and Drugs Act defined the terms misbranding and adulteration and gave the federal government authority to take legal action. The Federal Meat Inspection Act protected American consumers against meat from animals that were diseased, dying, or dead. Prior to 1900, milk served as a common vehicle for transmission of diarrheal diseases, as well as infections such as typhoid fever, brucellosis, and tuberculosis. In 1924, the U.S. Public Health Service published the Pasteurized Milk Ordinance to assist states with the development of voluntary pasteurization programs. Today, all states abide by this ordinance, which is governed by the Food and Drug Administration, or FDA. While it has been widely successful in the reduction of milk-borne diseases among pasteurized milk drinkers in the U.S., unpasteurized or raw milk drinkers remain at risk for contracting a milk-borne disease. The Federal Insecticide, Fungicide, and Rodenticide Act of 1947, also known as FIFRA, set up the basic pesticide regulation system for the U.S. Today, FIFRA is governed by the Environmental Protection Agency, or EPA, and contains approximately 25,000 registered pesticide products. The current division of food safety responsibilities at the federal level has been modernized in some ways, but still remains highly complex. In contrast to a single, unified federal entity that oversees the food safety system, the U.S. food supply is governed by more than a dozen federal entities. The two main federal agencies that have regulatory authority for food safety are the FDA within the U.S. Department of Health and Human Services and the Food Safety and Inspection Service, or FSIS, within the USDA. The EPA and the Centers for Disease Control and Prevention, or CDC, along with various other departments, agencies, and bureaus, also have important roles in food safety. They all work together to ensure a safe food supply. FDA has regulatory oversight of more than 80% of all U.S. domestic and imported foods. This includes produce, dairy products, seafood, shell eggs, and many other processed foods. It also regulates bottled water, infant formulas, and food additives. FDA works to ensure that these products are safe and correctly packaged and labeled. The Food Safety and Inspection Service, or FSIS, is a public health regulatory agency within the USDA responsible for ensuring that the nation's supply of meat, poultry, and egg products is safe, wholesome, and correctly packaged and labeled. FSIS also regulates processed foods that contain over 3% of meat or poultry products. For example, FSIS regulates pepperoni pizza because there is over 3% meat in the product. It does not regulate cheese pizza because it does not contain any meat. Instead, that responsibility falls to FDA. The Environmental Protection Agency, or EPA, protects our nation's food supply through the regulation of pesticides and water. EPA is responsible for ensuring that Americans are protected from potential health risks posed by eating foods that have been treated with pesticides. Unlike FSIS, FDA, and EPA, CDC is not a regulatory agency in food safety. Rather, it coordinates human disease surveillance and outbreak investigations. CDC serves as the vital link between foodborne illness in people and the food safety system. CDC also defines the health burden of foodborne illness by monitoring disease trends in the U.S. population. Each federal partner has a unique role in our food safety system. Let's take a further look at each partner. FDA works closely with states to perform inspections of food industries and establishments. FDA also sets standards for food products to ensure safety and quality. The FDA Center for Food Safety and Applied Nutrition conducts and supports food safety research, develops and oversees food safety and quality regulation, and coordinates and evaluates FDA's food surveillance programs. The FDA Center for Veterinary Medicine ensures that animal medicines and antibiotics used in food-producing animals are not harmful to human health. In 2010, Congress passed the Food Safety Modernization Act, or FSMA, which was the first major overhaul of the FDA food safety regulatory structure since the early 1900s. Remember, FDA regulates all foods other than meat, poultry, and pasteurized egg products. FSMA shifts the focus in food safety at FDA from response to prevention by taking a risk-based approach. Under the law, a series of new regulations are being introduced for food products under FDA jurisdiction, including farmers who grow fresh produce. These regulations focus on prevention, inspection, and compliance, imported food safety, response, and enhanced partnerships. FSMA provides FDA with new tools for inspection and compliance, including but not limited to increased inspections of domestic food facilities and enhanced detection of foodborne disease outbreaks. FSMA has direct impact on FDA-regulated food products from farm to fork. FSMA also directed CDC to designate a series of integrated food safety centers of excellence, comprised of partnerships between state health departments and academia. The centers serve as a resource for public health professionals at the local, state, and regional levels. They identify and evaluate model practices and develop training materials for foodborne disease surveillance and outbreak investigations. The centers share this knowledge with other health departments in order to strengthen the national network of public health officials who respond to outbreaks of foodborne disease. FSIS works to ensure food safety in meat, poultry, and egg products. FSIS personnel inspect animals before slaughter, inspect carcasses after slaughter, and perform food safety verification activities at meat and poultry processing establishments. In 1996, FSIS established regulations that required the development of a Hazard Analysis and Critical Control Point Plan, or HACCP plan, in meat and poultry slaughterhouses and processing establishments. These regulations were developed in response to decades of research and foodborne disease outbreaks, such as the Jack-in-the-Box outbreak of E. coli 0157H7 infections in the early 1990s. HACCP was first developed for use in the space program to minimize the risk of astronauts contracting a foodborne infection. Today, HACCP is a food safety management system that requires facilities to identify their critical control points in the production process where hazards can contaminate food. In turn, facilities must develop plans for monitoring these control points and assure that appropriate corrective action is taken if problems are identified. For example, a HACCP plan may identify a refrigerator temperature as a critical control point, with instructions as to what has to be done if the temperature rises above a certain level. The HACCP system includes 7 underlying principles that have been accepted by government agencies, trade associations, and the food industry around the world. These principles have been successfully applied in food processing plants, retail food stores, and food service operations. Where there is a foodborne illness outbreak caused by meat, poultry, or egg products, FSIS is responsible for identifying the source of contamination by conducting a traceback investigation. Likewise, FDA is responsible for conducting a traceback investigation for products under its jurisdiction. A traceback investigation is the method used to determine and document the distribution, production chain, and the source of a product that has been implicated in a foodborne illness investigation. Traceback investigations are often lengthy and complicated processes. State and local health agencies, agriculture agencies, and CDC may all collaborate on traceback investigations. The goal is to track the contaminated food product from the fork all the way back to the farm. Both FDA and FSIS can ask companies to recall products involved in a foodborne disease outbreak. In most instances, these are voluntary recalls initiated by the company. Through FSMA, FDA now has authority to initiate a mandatory food recall in addition to its existing authority to request voluntary recalls. Although FSIS does not have mandatory recall authority, the agency can immediately detain meat, poultry, and egg products that do not comply with federal statutes. FSIS can also issue a notice to the public regarding a company's product. CDC functions differently than FDA and FSIS. Remember, it does not write or enforce regulations regarding food safety. When a state needs help investigating a foodborne disease outbreak, they can ask for assistance from CDC. CDC can assist with investigations of multi-state outbreaks or large or difficult single-state outbreaks and recommend control measures. CDC also coordinates national foodborne illness surveillance, conducts laboratory testing, and performs epidemiological analyses to enhance our understanding of foodborne disease risk factors. CDC works closely with the Coordinated Outbreak Response and Evaluation, or CORE network at FDA, and the Office of Public Health Science and Office of Investigation, Enforcement, and Audit at FSIS to conduct outbreak investigations that often include traceback activities. The degree of involvement of FDA and FSIS depends on the product implicated in the outbreak relative to their respective jurisdictions over specific foods. Several surveillance systems are used in the U.S. to provide information about the occurrence of foodborne illness. CDC's foodborne disease surveillance systems include FoodNet, the National Electronic Disease Surveillance System, or NEDS, PulseNet, and various other pathogen-specific surveillance systems. You can find more details about these surveillance systems on CDC's website at www.cdc.gov. All of CDC's surveillance systems rely on data from state and local health agencies. Each surveillance system plays a role in detecting and preventing foodborne diseases and outbreaks. PulseNet USA is a national network of local and state public health laboratories. It connects cases of foodborne illnesses to potential outbreaks by using DNA fingerprinting and whole genome sequencing for multiple types of bacteria. Epidemiologists at the local, state, and national levels use the laboratory information gathered by PulseNet to help identify clusters of illness. Although our national food safety system has drastically improved during recent centuries, foodborne illness still poses a threat to approximately 48 million Americans each year. While responsibilities of our national food safety system are divided among multiple federal entities, they all work closely together to help states investigate, control, and prevent foodborne disease outbreaks. Our next video will introduce state agencies and their responsibilities within the food safety farm-to-fork continuum.